classic teaching when it comes to pain, and this is the teaching that I got, is that generally speaking, pain arises from one of three problems. So if you have pain in your index finger, that pain can arise from an intrinsic problem in the index finger, right? Let's say I have a fracture dislocation of my finger, or I have arthritis in that finger. As a matter of fact, I have a little bit of arthritis in this finger right here. So that might be a mechanism by which somebody would have an intrinsic problem at the end organ. At the other end of the spectrum, at the other end of the circuit, if you will, is the brain. Okay, so the second reason somebody might have pain in their index finger is because of a central nervous system problem. And so what might an example of that be? Some patients have pain in their index finger because of multiple sclerosis. Patients have been described who have had pain in different parts of their body as a result of a brain tumor, or certain types of seizure disorders or other neurological problems somewhere in the central nervous system. The third mechanism by which someone might have pain in their index finger, and it might not be isolated to just the index finger, but it could be part of that whole bigger picture, is a radiculopathy, right? We've all seen patients before who had a radiculopathy, and they say, "Oh, doc, I got pain, numbness, tingling, whatever, in my hand or in my finger or whatever." Of course, then you look at the anatomy, you look at the pathways, look at the pattern, and they say, "Well, that sounds like a radicular pattern," and so it could be radiculopathy, right? I don't know what's causing it. There's nothing that can be done. Very often we forget, and of course I'm using the index finger as a more obvious example, right? But we forget sometimes that there is something that connects the spinal cord past where you would have the radiculopathy to the index finger. We call this the peripheral nervous system. So what are we talking about in this case? Every single one of us as a physician has seen this before. We've seen carpal tunnel syndrome, and patients will tell us they have pain in their index finger. Now, commonly they won't say it's isolated to their index finger, but they have pain in their index finger. And it's not a problem with the finger itself. It's a problem in the hand and at the level of the wrist with the transverse carpal ligament, which is compressing the peripheral nerve, and in this case, the median nerve, right? For those who do more work in the lower extremity, you might be familiar with tarsal tunnel syndrome. You might be familiar with soleal sling syndrome. You might be familiar with foot drop as a result of compression of the common perineal nerve at the fibular neck, right? So these are peripheral nerve problems that are causing pain at a place that is not where the peripheral nerve problem itself actually is. When we start to think about this way, and we start to look at the peripheral nerves, and all you have to do is open up an anatomy book, whether it's Netter or Grant or Gray's anatomy, whichever anatomy book you want to pick up. Just open it up and take a look at the peripheral nerve anatomy. And once you start to familiarize yourself with that anatomy, you'll start to see patterns. You'll start to see patients who come in, let's say, with Meralgia Paresthetica, which involves the lateral femoral cutaneous nerve going down to the anterolateral thigh. Sadly, there aren't a lot of physicians that are familiar with the treatment options for problems like this. And that's where people like myself, people like Eric Williams, people like David Brown, people like Tim Tollestrup, that's where we come in. We can help you figure out how to manage and treat these types of cases. Just feel free to reach out to us and we'll help guide you through it. But this is the way in which we think about, when we were trained to think about pain. When we think about pain, we think about it from an anatomic standpoint. And if you can isolate the anatomy, which is responsible for the pain, then there's a good chance you can help that person.